Welcome, everyone, and congratulations on your admission to our public health program. We're so excited that you've chosen to apply to MCPHS, and we hope to give you as much information as possible this evening to help you make your final decision. I am joined today by one of our faculty members, Professor Renate, and a current student, Jeannie Fan, for a panel discussion to really talk about all things public health. So I'm really going to dive right into it. After I will let the faculty member and student introduce themselves. Do you guys want to do a quick introduction and then we'll get into the questions?
Sure.
Professor Renate, why don't you start?
All right. So my name is Ashwini Ranade. I am an assistant professor of public health. I have been teaching at MCPHS since 2018. A little bit about my background. I practiced as a dentist in India before I came to the States. I got my master's in public health, and then I continued to get a doctorate in population health. So my research interest primarily is in looking at access to healthcare and everything pretty much at the intersection of healthcare delivery and public health.
Thank you. Jeannie, would you like to introduce yourself next?
Yeah, so my name's Jeannie. I am a fourth year public health student, so I'm on my way to getting my bachelor's. I am also getting a minor in biology, which is super cool. I'm looking to get my master's right after this, so that'll be really exciting, my master's in public health. And looking beyond grad school, I'm looking to go into project management. So, really taking a close look at health equity projects and looking at social determinants of health.
Wonderful. Thank you so much for your introductions. I'm going to start off the panel session with a question for Professor Ronaday. Please describe the strengths of the program as you see it that makes this program the best choice for students.
Sure. So I think like the very first thing that comes to my mind is that students over the course of their undergraduate program learn a lot of transferable skills. So that's sort of the key feature of the public health program because unfortunately, as you've seen, the pandemic has really brought public health epidemiology to everyone's attention, and everyone can now appreciate that there is so much that public health professionals, practitioners, and researchers have been doing and continue to work on. So the program really prepares you to learn about the methodologies and really all the background work that happens in responding to these challenges. As this is not going to be the last one, I'm sure we're going to see many more of these given so many changes that have happened in our environment itself. So the public health program at MCPHS really prepares students not just by training them in public health, but also they acquire so many transferable skills that they once they graduate they can pretty much apply to any healthcare setting.
That's excellent. Thank you so much for sharing that. Continuing on with that, as students are really prepared for the world of public health, why do you enjoy teaching most at MCPHS?
So what I've really enjoyed during my time at MCPHS is the interaction that I've had with students. We have small classes. It's not going to be your typical 200 students or 300 students in a classroom. So our classes are really small. They're capped at 25 students. So the professor really gets to know the student by the end of the semester. During our classroom session, depending on what course you're taking, are heavily focused on discussion that happens. So me as a professor has learned so much from the students as well, because they really bring out so many different experiences, lived experiences, and really what is happening outside of the classroom. So that has been really an enriching experience for me, where I now make an effort to make sure that I connect students with not sort of to say the bookish material, so as to say, but how it really relates to their life outside of the classroom. So I've really enjoyed those interactions in our smaller classrooms here.
Wonderful. Thank you so much. Jeannie, I want to turn it over to you. Can you first talk about why you chose to attend MCPHS think way back when to when you were an incoming freshman.
Yeah, so even prior to me being an incoming freshman, I had actually heard of MCPHS through my sister, who is an alumni. She went through the PharmD program, but she had nothing but good things to say about the school. And so that had already sort of been implanted in my mind, especially when it came to career preparedness, not even exclusive to the PharmD program, but she had talked about this element of career preparedness throughout all the programs at the school. But in terms of the public health program specifically, what I learned about it, even after I had been admitted and continued to go to MCPHS, like the small classroom size or small and close program style of the public health program is really interesting. And Professor Renati had mentioned this, but my connections with all the public health professor have been more than valuable. Um, every professor has very unique and very unique and very large um, list of things that they've done in the public health field in the past, and they have all these like decorated experiences, and being able to learn from all of them in the classroom setting, especially at a smaller capacity, has been really meaningful to me as a student who prefers smaller program setting. So I think that has been really valuable, and I really appreciate the relationships with not just my professors, but with my peers in the program because of the size and the culture of the program.
That's awesome. Can you share with me an example of how you think the program has prepared you for the career in healthcare that you're aiming for, like you mentioned earlier?
Yeah, so kind of going alongside the small setting, what's even arguably more important is the coursework, right? The actual courses that we take. And I think the coursework of the public health program is extremely broad, but in the best way possible, because public health is a really broad field. There's so many things that you can do to it. So there's this element of preparedness that students have where they're exposed to all these different facets of public health, whether it's epidemiology or policy or community health. These are all aspects that you get to learn in the program. And especially when you're applying for jobs or applying for grad school, employers will want to know what you know and how broad and nuanced and complex your understanding of public health issues are. And you can't really do that unless if you sort of have a more holistic picture of all the things that are happening in public health. So I really appreciate how the public health program at MCP does that. And then the program really grew my passions. So again, as we're like figuring out what we like about public health, what we want to do after we graduate, each of the classes, you start to realize what topics you're interested in, and especially in classes that are more in tune with like community health and epidemiology. These were topics that I found myself to be really interested in, and because of these, again, these close relationships, these small classroom settings, like you really get to delve into those passions. So for me, I eventually figured out that I wanted to go into project management for health equity projects because of these classes, and being able to have gone through all these the variety of coursework that we had to learn, I feel prepared because as a project manager, you want to know all the components and like the summative aspects of a project, whether it's the stakeholders, the actual public health issue at hand, um, just everything involved in the project, policy even. So I think the program really prepared me in that aspect.
It's wonderful. We're so excited to see what you're going to do after you leave us next year. So I want to turn it back to Professor Renate. Can you provide some examples of accomplishments, appointments, accolades for faculty within the public health program itself?
Sure. So actually, one of our faculty members, Professor Hawkins, he recently analyzed, and his article was published very recently. He looked at racial and ethnic disparities in respect to COVID-19 incidents, and that was really eye-opening, so as to say, to see the level of disparity that these different population subgroups experience with like, what all of us are grappling today, but it disproportionately affects those. And then very recently, the public health faculty, me and two other professors, we were successful in securing funding from the American Cancer Society to look at the smoking policies at our three campuses, and that was really interesting to take sort of a systems view of what's happening, where there's been a push to have smoke free campuses. So I think this funding money is really going to help us push the cause at MCP. So that was one of our really, like, three of us had been really looking forward to this, and it now this will really help us take our vision for the school forward, given that we are a healthcare school. There are lots of things, but these are sort of the two things that have happened in this year. And the faculty has really, like, focused on looking at different opportunities for students. We have a center for undergraduate research, where faculty mentors a lot of students over the year, and we actually have a very competitive grant application process for that. So that really gives the students an opportunity to participate in research very early on in their undergraduate curriculum. We also have the undergraduate research conference, which happens every year in April, and that's again really an opportunity for faculty and students to showcase their work. So these are some things that the program has to offer beyond courses that they take in their programs.
Thank you so much for sharing that. Jeannie, I want to turn it back to you. You shared with us kind of your plans for graduation and the classes that have really helped you. Have you had any activities outside the classroom that have really pushed your vision of your career forward, such as an internship, volunteer experience, anything like that?
Yeah, so I'm kind of all over the place actually, which is awesome. I'm grateful for that. In terms of outside of the classroom within the university, I am the president of the Public Health Student Association, which is really awesome, and our lovely advisor is Professor Renati. So it's really great. One of the things that we did was we did a social media campaign initiative where we sort of promoted both the duplicitous need for public health, promoting good public health practice of being able to wear masks or other examples of good public health practice. But on top of that, because we are in a pandemic, there are a lot of increased, but also a lot of limited opportunities to sort of stay connected as a school community. So we were able to get a bunch of MCPHS students to sort of participate in this campaign on Instagram, which was really awesome. I also peer tutor for statistics and biostatistics, which are extremely integral to your public health education and anything that you might want to do beyond that. A lot of biostatistics especially is extremely important. And then with regards to Professor Renati's mention of the undergraduate research grant, my group actually recently was a recipient of the mini grant, which is really awesome. So we're doing research on clean versus non-clean cosmetics, which is really awesome. And that's also very important when it comes to public health and environmental health, how that plays in our lives. But then outside of the university, I've done a few internships. One is with Brigham and Women's Hospital at the Center for Clinical Investigation. So I was a research operations intern. Research, again, another really important part of public health. So I really got to witness a lot of the interworkings of how a research study is done, sort of the operational aspects of it, and making sure that different studies were able to carry out their studies successfully and safely. So I really enjoyed that internship. I did that for over a year. And then I also recently completed an internship with Mass General Brigham. They're a really huge hospital network. I worked with their drug policy team, and I was able to do some work with regards to analyzing data on drug use across the system and then being able to collect those findings and maybe make some sort of recommendation with regards to how substances are used across the system. And that was a really eye-opening experience, which sort of propelled my want for working in health equity projects, and substance use is such a huge part of that. And then I'm also a undergraduate research assistant at Boston University's Child and Family Health Lab. So we look at studies pertaining to child and family health, especially in the scope of autism and cancer and sickle cell. So these are all the different things that I did both inside and outside of the classroom. Some of these things were a direct result of the coursework that I learned and sort of the push for my professors to want to do more outside of the classroom. So I've had a lot of fun doing this.
That's very impressive. Thank you so much for sharing all of your experiences at MCPHS with us. Going off of that, now that you're in your final year and you're ready to move on, what advice would you give, the students watching tonight who are really just starting out on potentially a public health education journey? What advice would you give them?
Yeah, so I think the most important thing, or I guess two most important things, would be to really stay organized and really sort of fine tune your study habits, your organizational habits, how you want to sort of navigate your coursework and your life essentially. It's a big ask, and it's something that we continue to learn every day, but especially throughout your college career, it's super important to sort of stay organized and really find ways to keep yourself accountable, keep yourself on track. It'll make things a lot easier. Um, and then the second thing would probably be to really see where your strengths and where your sort of your desires for what you want to do in the future are, and really try to fine tune those too, and then adapt those to your goals in public health. Because it is such a wide field, I feel like it's kind of hard for a lot of students to really choose what they want to do, or sort of see what their strengths are and what they actually like. But it's sort of this whole journey. And I'm sure Professor Renati can attest to this, but like even after you graduate and even after you like land a job, or you think you're in one field, you could very well transition to a different field or a different job. And that's what's great about public health, is that it's so transitive and so transformative, and you're able to do that. So I think students in their undergraduate careers should sort of treat it the same. Really be open to your strengths and really be open to what you want to do.
Wonderful. Thank you so much for that final piece. I do want to ask one last question to Professor Renate. Jeannie's going to be one of our very impressive alum. I'm very sure of that. Just after this brief conversation, what are some of our other alumni doing? Where do you see, alumni going, or what are you hearing from the current seniors right now about what their next steps are?
Sure. So a lot of our students actually go on to continue their public health education. Most of them enroll to get their MPH, and MCPHS also has a master's in public health program. So it's really a good fit, because they're so comfortable by the time they finish their undergraduate journey that they can really think about what they're going to do next. In terms of job opportunities, we've had students work at pretty much all the hospitals in and around Boston, which is really great, in different capacities, be it research, be it project management. Some of our students have also got into clinical research, like Jeannie. She has a minor in biology, so that also opens up a lot of opportunities with trying to pursue a clinical research position. We have some students who continue to with their education, go on to get an MBA. Some of our students have gone to PT school, PA school, occupational therapy. We have we actually, one of our students this year got accepted to the London School of Tropical Medicine, which was really exciting for our faculty to see, and we are so proud of her. And then we have a student who is currently working in the Ministry of Health in Saudi Arabia. So really, there are just so many opportunities that our students can pursue once they're done with their bachelor's in public health.
Wonderful. Thank you so much for sharing that. And thank you both so much for joining me today in this conversation. I think every time I talk to you guys, I learn something new about public health every time. So I'm so glad that you both were here today. I hope this was helpful to everyone who listened in and tuned in tonight. If you do have any questions about public health, specifically about next steps to join us at MCPHS this fall, please don't hesitate to reach out to the admissions office. That's all we have for today. So thank you everyone for joining us, and we hope to see you on campus this fall. Thank you so much. Good night.